I'd like to welcome everybody to the first of 3 webinars focused on health equity, hosted by Whitefoord and funded by the Zeist Foundation and HRSA. Just realized I don't have the slides up. Let me do that real quick. Let me share my screen. Okay, there we go. So again, this is the first of 3 webinars focused on health equity, and it's hosted by Whitefoord and funded by the Zeist Foundation and HRSA. For those not familiar with the foundation, with Whitefoord, it's a community-based and driven federally qualified health center that's dedicated to providing health care through school-based health centers and in community settings. It also promotes health awareness, encourages healthy families, and advances early childhood development. The mission is to create health equity by delivering quality health services complemented by other programs that address the social determinants of health, including early education. And I'm going to add a link to the Whitefoord Community Program in the chat box as soon as I finish my introductions. This first webinar is titled Health Equity and Improved Outcomes, School-Based Health Centers and Back to School. And it's going to feature a distinguished panel who will discuss how school-based health centers play an important role in creating opportunities for health for all children. Creating health for all children and how COVID-19 has highlighted the importance and challenges of ensuring routine care is available in vulnerable communities. Today's featured panelists include Carol Patton. Dr. Patton is one of the first dentists to establish comprehensive oral health in school-based health centers in the state of Georgia. She's provided quality dental care to thousands of vulnerable patients facing consequences of health disparities and was the first to provide full-scope dental care in the state. Dr. Patton is an inspirational leader who motivates action to eradicate the most common childhood disease dental caries. She has worked as a clinician in the field of general dentistry for more than 25 years, advising partners in dental operations and financial sustainability. Dr. Patton holds a DDS from Meharry Medical College School of Dentistry, an MPH from the Rollins School of Public Health at Emory University, and a JM from the Emory University School of Law. Currently, as Dental Director of Whitefoord, Dr. Patton oversees the daily operations of Whitefoord Inc., school-based and FQHC dental clinics. Jean O'Connor is the CEO of Whitefoord. Prior to her current role, Dr. O'Connor spent 5 years as the Chronic Disease Prevention Director and Chief Public Health Policy Officer for the state of Georgia. In those roles, she oversaw $30 million of statewide programs related to the risk factors for chronic diseases. She also oversaw the state's health improvement planning process and partnerships to improve population health. Jean is an adjunct associate professor at the Rollins School of Public Health at Emory University, where she began teaching master's students in 2003. And she's also teaching in the doctoral program at UGA, where she's been since 2017. Jean is a past president of the National Association of Chronic Disease Prevention Directors and on several nonprofit health boards, including the American Diabetes Association. Her JD and MPH are from Emory, and she earned her DRPH in Public Health Leadership at the University of North Carolina at Chapel Hill. Vita Johnson is a Marcus Professor in General Academics and Pediatrics and Executive Director of Partners for Equity in Child and Adolescent Health for the Department of Pediatrics at Emory University. Prior to her current position, Dr. Johnson was the Director of Community and School-Based Clinics for the Department of Pediatrics at Emory University. And in that position, she served as Medical Director of the Whitefoord Community Program, which consists of 2 school-based health clinics and the Boat Rock and Lindbergh Women and Children's Health Clinics affiliated with the Grady Health System. Dr. Johnson has participated in the development of national standards for comprehensive school-based health programs and has also been active in promoting school health programs in the state of Georgia and in petitioning Congress for increasing federal allocation for school health centers nationwide. She's a member of the American Academy of Pediatrics and serves on the executive committee for the Academy's Council on School Health. And before we begin our program, just want to mention why I'm here and who I am. Again, my name is Laura Lloyd, and I'm the Associate Director for the Region 4 Public Health Training Center, and I'm going to be facilitating the discussion today. Our training center is also funded by HRSA, and we provide training for the public health workforce and field placements for students in the 8 southeastern states in Region 4. Our work is guided by state and region identified needs and focuses on strategic skills and priority health concerns in the region. I'll also add our web link into the chat box so that you can check out what we have available on our website, which includes archives of all of our recorded past trainings as well as upcoming activities. During today's webinar, I will be asking the panelists questions, but as I mentioned earlier, would encourage you to ask any questions as the webinar progresses in the chat box or the QA box. I will do my best to get to as many questions as possible, and if I have time at the end and I'm able to unmute people, then I will invite you to unmute yourself and ask a direct question of any of the panelists. And with that, I think I'm going to stop sharing. And I'm going to ask my first question and begin our conversation by asking Dr. Johnson, if I can start with you. What have you seen around the country regarding the number of school-based health centers and the number and types of populations served by them?
Well, you know, school-based health centers have a very storied history. Started in the 80s, mainly to address adolescent health, and then expanded throughout the course of time up until now to really address the healthcare needs of all children throughout the country. The primary focus is on underserved children. There are currently about 2,600 school-based health centers throughout the country, which really is sort of, for me, somewhat of a disturbing lack of penetrance because we have over 100,000 public schools in the country, and we know that school-based health centers are instrumental in not only building health equity, but also improving the academic achievement for children, as well as increasing access to health care. So, you know, the goal is, how do we take this model to scale? You know, and how do we penetrate more schools so that more students will have the advantages of being able to have their health addressed, both their physical health, their oral health, their mental health, all the social issues that come into play, and also their interaction with the school districts and the school system as a whole. How can we take that to scale so we can improve the well-being of children? And so nationally, there is a movement right now to try to increase the numbers to 25,000. It's a bit ambitious, 25,000 by 2025. What is this, 2020? So you see we have quite a daunting task, but I am behind that 100% because we do have to take this wonderful model to scale so that we can not only improve the health outcome for children, but so that we can improve their ability to move out of poverty into prosperity, because education is a direct pathway out of poverty. And also education is direct linked to good health. So, so the movement is going. We have new leadership within our national alliance. We're partnering with everyone we could think of, including NAC, the FQHC's community health centers, as well as community schools and every other organization that engages the school in order to be able to expand this valuable program.
Thank you, Dr. Johnson. And I wanted to mention to other panelists, if you have anything to add to any of the responses, feel free to jump in. Although I do have questions I'd like to direct to each of you. So Dr. Patton, how are oral health needs being met at school-based health centers for underserved populations?
Quite challenging these days. That's the short end of the stick, but very typical. We have been challenged with providing more PPE and more coverage for our patients because of the aerosols that we use within our, as we do our dental services. So that has been quite a challenge, but many things are the same. When we initially started during the COVID epidemic, we were able to get many of our patients through our teledentistry. So COVID has kind of done great things in that sense. We kind of started with the teledentistry, and then we've now moved on to preventive care. But it's been a challenge. What our biggest challenge is getting people safe, getting people in, getting people distance, getting people sanitized. That's the biggest challenge. And as we open back up, a lot of people ask me about my numbers. We are busy as ever. During the COVID epidemic, a lot of the dental needs, they were unchecked. People were coming back with abscesses and things of that nature. But now, since we're back open again, we're able to address many of these needs.
Thank you. Dr. O'Connor, how do school-based health centers set children in the community up for success?
Yeah, thanks, Laura, for your question. And just along the lines of what Dr. Johnson said, you know, school-based health centers really can help lift children and families out of poverty or out of challenging circumstances, because school-based health centers, when they are done right and they are in the school, and fortunately in the case of Whitefoord, we also have several locations where we have exterior doors that the school system allows us to use to help allow adults to enter our clinics. The school-based health center really can help a child who otherwise might not have access to regular dental care. I mean, for most of us who are fortunate enough to have dental insurance and maybe pay out of pocket for part of that, we know just how expensive that is. And so for a lot of the children that we serve at Whitefoord and that are served at school-based health centers across the country, the parents may just not have those kinds of resources to devote to things like dental care. Our school-based health centers can help provide vaccines. Whitefoord and many of the other school-based health centers that Dr. Johnson works with routinely will help kids stay updated on vaccines, or will help them to identify the need for a vaccine that might not have gotten caught. A lot of children, when they turn 9, 10 years old, they may not have another mandatory vaccine until they're 16 or 17. And so things like flu vaccine, right, opportunities are really missed opportunities because the child might not be seeing another provider in that time. The school-based health centers also, a lot of the kids we see, not all necessarily low-income kids, but a lot of the children we see have pretty substantial mental health needs too. They just need someone to talk to. Some of them have more serious mental health needs, and a school-based health center can help identify those issues early and provide a regular point of contact, a safe place for those children in the school. And we know, just like what Dr. Johnson said, if we can get kids through and to third grade and reading at third grade, reading level at third grade, their odds of staying in school and graduating are much higher. And similarly, we know that if we have school-based health centers available, we're going to be able to do things like lower missed numbers of school days for things like asthma or other chronic conditions, or even just those routine illnesses that could have been avoided with vaccinations. And so I could go on and on. Dr. Johnson has a lot more data, and I know Dr. Patton does as well, so I'll stop. They may want to jump in, but there are just so many opportunities. And again, with the exterior doors that so many school-based health centers are being built with now, you might see the child one day, and then maybe they tell their parents, and the parents realize they can be seen as well. And because we are a federally qualified community health center, and so are many other FQHCs, we're able to see those parents, including people who don't have insurance, and really provide an accessible point of care right there in the community with fewer barriers to getting that care. So I'll stop there. And
I want to just kind of piggyback on something you said, and something occurred to me while you were talking. I think for school-based clinics, one of the things that the children like is they like coming in a place that they own. I mean, they know the school, they're comfortable in the school, and this is a place that they can come in, they can get in the dental chair, ask you all the questions that they want answered, and get all the information for them. And so I think that's real important. I know we're talking a little bit about equity and education. That's important for the buy-in, for children to want to be there, because they're the ones that's got to make their health care efficient, and they have to be the caretakers of their own health care. So I think that's important to mention that. So I can't mention it enough, and I'm sure we'll say this again before it's all over with.
Dr. Johnson, you're on mute.
I'm sorry. I forget, I always mute myself. So I agree with all that's being said, especially Jane said about how this impacts the lives of these children. I think also what's really important is that, you know, school-based health centers eliminate every barrier to healthcare that you could think of, right? So if you think of costs, which is we've already alluded to, but also transportation, hours of operation, a parent's inability to have leave from work, especially a lot of our families who work, you know, on the front line and don't have covered leave to take their children to the doctor. But also we have a lot of parents who really can't prioritize the healthcare needs of their children for various reasons. They have other things they worry about, like, you know, a roof over their heads or food on the table. And then another segment of these children live with grandparents and great-grandparents who don't have the ability, both physically as well as financially, to get their children to the doctor. So school-based health centers eliminate every barrier to healthcare that you could think of, which really makes it probably the best model of healthcare for underserved children throughout the country. And another aspect is, you know, I always tell people, you know, with school-based health, you get to see children in the raw, right? You get to see them in the context of everything that impacts their lives, which is something different from what you experience when parents bring the children to us. It's sort of like, I always say the parents try to clean the children up when they bring them to us, but in school health, you see them just as they are. They come to school in the winter without a coat. A fifth kindergartner may be dressing themselves every day. They're hungry. They're dealing with a lot of trauma and psychosocial issues that you just don't see in your office. You see all of that up close and personal in school-based health. And as a result, you can actually create an infrastructure that addresses those issues directly. And that's really the history of the Whitefoord Community Program, the ability to create this sort of ancillary care for not only the child, but the family as well, because you can't care for a child in a vacuum. You have to bring in unfortunately, the issues of the home and the community and the school in order to do a good job. So that's probably one of the greatest roles of school-based health, in addition to the direct services for children. And, you know, Dr. Patton, she does an extraordinary job with the parents. You know, she's not going to bring that up, but she serves the entire community as well as all of Whitefoord. It serves the entire community. And so it's an incredible model that unfortunately can't be replicated to this extent because of the cost, but it is a great model with healthcare as the anchor.
I wanted to follow up on one thing you mentioned. Could you share a little bit about these ancillary services that are provided by Whitefoord Center and how that, you talked a little bit about how that supplements and serves the whole need, but can somebody share a little bit about that?
I could just briefly talk about the history, and then I'll let Jane talk about what they're doing right now. So when we started Whitefoord 25 years ago, I keep I lose track.
It is 25. This is 25.
25 years ago, we actually just started with the school-based health center, thinking that was interesting. You know, you take health to the community as opposed to having people come to the ivory towers for their health. Took about 6 months to realize that it wasn't really the physical health of children, but all the psychosocial issues that were impacting their lives. So we decided we would like go to the community and ask them, so what do you need in order to better care for your children? And so the warning to that is whenever you ask a question, be prepared to come up with an answer, right? Otherwise, don't ask the question is all I got to say. And so they said, well, I'm glad you asked that question. We need more direct social services in our community. We need a safe place for our children to go after school. We need jobs ourselves. We need to get our GED. We need a safe place. We need quality childcare. And so they came up with a litany, and much more of needs that the community identified for us. And so we essentially created that one step at a time, bought up houses across the street from the school where the school-based health center was, and started implementing that program. And at the core of it was a family resource center, an after-school program, and a child care, as well as GED and job training. And so that's how I started. And I'll let Jean sort of pick up on where they are right now.
Yeah, so our major sort of program, in addition to our school-based health center locations and our family medical center clinic, because we do have a standalone clinic as well to serve the needs of adults. The other major program we operate right now is that early education program that's been around for a great deal of Whitefoord's history. And we have the capacity to serve about 200 children, which we do on a sliding fee scale model, just like in our clinic. So those who can pay do pay, and then those who cannot pay a portion of what they can, and we offset that with grants and funds from the state. And what we've learned from that, and just like Dr. Johnson said, is that over the years the needs of the community have definitely evolved and changed as the world has changed, and there's less of a need now today in this particular area where Whitefoord is located for things like GED programs. But because of COVID-19, we've discovered, there is a greater need for substance abuse treatment and prevention programming. There's a high unemployment rate. Of course, many people are experiencing this regardless of their former income or where they live, but a high unemployment rate right now. And then we also are seeing and have today happening outside the window. I don't think you can see it behind me, but there's along with that unemployment rate, we're seeing much higher rates of food insecurity. And so we've partnered with the Atlanta Community Food Bank to try to bring food to this part of the city, to the families in this area, to kind of complement and offset what the public school system is not able to do during the summer for a lot of the families. So those are some of the kinds of things we do. And we also, within our health program, and Dr. Patton may want to talk about this, but are continuously trying to evolve what we provide in that health program to meet the changing needs as well of not just the children, but also the adults. And I don't know, Dr. Patton, do you want to say anything about that for your other clinical colleagues?
Well, it's so much about the school-based healthcare. I mean, it's just the best model ever. I just, like, where was it when I had my children in school? But I think what I want to, because this is kind of a little bit about what Dr. Connor was talking about, is I want to say a little bit about the interdisciplinary approach at school-based health centers. Oftentimes they'll come in for a toothache, but many times we can address the immunizations. It may be some food insecurities that they're having, and we're right there together. And so to me, that's comforting that I can get my patients what they need through the system. One of the other things that Dr. O'Connor hinted to is a lot of times the fees are a challenge, but there's a couple of ways that we address that. We have sliding fee scales. We're not turning any kid away because of their inability to pay. And we work with the patients to get them the health care that they need. So I'm particularly happy about that. And we're offering immunizations. We're offering, I can remember even doing trainings on bullying. I mean, it just goes on and on and on.
Thank you. I have a few questions in the chat box, so I thought I'd begin. And the first one is directed to Dr. Johnson. The question from Monica is, school-based health centers are currently established in Georgia, and how many are in the works for expansion? And has COVID-19 impacted the plans to continue expansion, as well as due to schools maybe having to shift focus to students learning from home and not being in the school buildings themselves?
These are great questions. And I've excuse me, I've been answering them probably for the past 2 months, so this is going to be easy. We currently have 52 school-based health centers throughout the state of Georgia. We started the expansion in 2013, where we only had at the time Whitefoord and Cohen. It's sort of a process that's sort of taken a life of its own in Georgia, and we really ramped up pretty quickly, a lot quicker than I ever thought we would. And I'm not going to go into what the process was and all of that, but we currently have about 52. We are currently working on opening 3 new school-based health centers here in Atlanta metro area in the fall. A huge challenge. You can imagine how huge that challenge is. But everybody's, motivated to continue the work, and so we said, okay. There are 2 more in South Georgia that are slated to open in the fall, but that's all questionable depending on what school districts decide to do as far as reopening schools. But we anticipate that, prior to COVID, our anticipation that we open about 5 or 6 more this upcoming school year. What has happened throughout the state is that, as it has happened throughout the country, is that majority of the school-based health centers have closed because of school closing. Whitefoord is one of those fortunate, systems where they not only have access to the external part without going through the school, but they also have come up with sort of innovative approaches to provide care for patients, to continue that, mainly through their COVID testing. I'm pretty sure you guys are doing telemedicine, right?
Mm-hmm. Yes.
Telemedicine. We found that when we surveyed all of the school-based health centers throughout the state, I think about maybe 10% were doing telemedicine pre-COVID. Now 98% are doing telemedicine post-COVID and during COVID. Well, not post-COVID, but during this pandemic. And everyone is actually being innovative about reaching out into the community in ways that they didn't historically. Because they've got to sort of continue this process of cultivating the relationship within the community so that they can be effective when school reopens. I've been working with a lot of the school districts and a lot of the school-based health centers to see if they could just partner together, because what's clear to me is that the challenge that school districts have to reopen are just daunting. You have all of these different models of reopening. You can have the hybrid, you can have the continued distance learning, you can have a combination of starting off with distance learning and ending up with full face-to-face. Whatever they come up with, it's going to be almost impossible for them to implement. The social distancing, the monitoring of children with illnesses, the testing, the controversy over who wears a mask and who doesn't. I told them, forget about little ones. Don't even try to go that way, because it's not going to happen. And even with older children, it's going to be a challenge for the schools to be able to do that. So they're going to have just an enormous task to undertake in order to do this. It's going to require that the entire community come alongside them and help them with this. Not only school-based health centers, but any other resources they have, family connections, the health department, you name it. Everybody's going to have to join forces with them to do this. But I do see school-based health centers as having a critical, important role in all of this, because we provide healthcare on site, right? So you can continue the COVID testing. You can make sure the children are immunized. You can help with screening, if you have to do temperature screenings or monitoring children that, may become acutely ill while they're in school. You can be a resource to the community like Whitefoord has been, where you can continue to have that, testing and contact tracing and all those things that are required to do this. So I see school-based health centers as playing an important role. Finally, I think probably one of the greatest roles that we can play is in the context of behavioral health, because we know the impact of COVID on children is just enormous. A lot of trauma, a lot of, anxiety, a lot of depression. They are living in households where people are no longer employed, where they're sort of cooped up together, where the tensions are running high. We have increase in domestic violence.
Yeah.
We haven't demonstrated an increase in child abuse, because 50% of child abuse comes from the schools. And so you hadn't been able to monitor that. But I guarantee you, if you actually went in and assessed it, we have an increase in child abuse as well. And so these children have a lot of trauma along with their families, along with the teachers, for God's sake. Everybody forgets about the teachers, right? they're training the teachers to be trauma informed when no one's paying attention to the teachers who also are dealing with a lot of adverse emotions behind this. So I see school-based health centers as playing a critical role with the reopening of schools, and to, you know, figure out what the new normal is. They may have to do more telemedicine than they did before, even afterward initially. But I think they're all up for the task, and I kind of look forward to seeing how we can play an important role in all of this.
And I would just add, you know, I echo everything that Dr. Johnson said, and we see in particular that, you know, many of the children need kind of that stable, familiar place right now more than almost anything else. And so school-based health centers can be that resource for those communities. You know, COVID is meaning it's taking a variety of forms, but knowing that that resource is still there, we've seen that that's been very important to the community here. And Dr. Johnson talked about how we remained open. Again, we are fortunate to have exterior entrances, and had a very willing partner in our school district who, when they closed everything, we said, wait, you know, can we please still use these facilities? And so we have been using our facilities to support the community through COVID testing, and we believe that's going to help us in many ways reopen and switch from doing COVID testing to seeing even more students going into the fall. But I think many of the parents and people we've seen for COVID testing have been in some way affiliated with the school. They went to school there. They know someone who went to school there. You know, they have a friend whose children go to that school, and that is how they have come to us for COVID testing. So it's been a very interesting view into the community as well. The other thing about return to school, health equity, and school-based health centers is that, you know, Dr. Johnson was talking about child maltreatment and domestic violence, intimate partner violence, that kind of thing. And we also know that schools are significant monitors for that. Schools are also a place where many children and families get a significant number of their daily calories. So we know that schools are going to continue to remain central in many ways to the health and well-being of not just children, but whole families. And so regardless of what gets decided with COVID, I personally think that there will be a place for school-based health centers. The operating model might have to be different, but in this coming school year. But I do think that just as a school is going to remain a place where people look to for food and calories, it's going to be a place that where school-based health centers do exist, that people are looking to them for that clinical advice and information. And I don't know, Dr. Patton, if you want to add anything.
No, we just say it time and time again. School-based healthcare, it's the natural resource, and it's all the arrows are pointing back to school-based healthcare and education. So it's just the natural. I think it's naturally where it's supposed to be.
Thank you. I just wanted to add, related to what y'all were just talking about, and you touched on several of these, but another question that Monica had was how COVID-19 has impacted current school-based health centers' ability to operate, and specifically the capacity to see patients. Has it remained the same? Has it increased or decreased since the schools were closed? And as well as the capacity for clinics to have employees working in the school-based health centers at full capacity, or has it been full capacity or reduced? Can you just kind of clarify those points?
I just want to say a quick thing about the capacity for oral health. With the initial shutdown, shelter in place, as I said before, we did have to go to the telehealth. And so it did impact it at that point. What we did to kind of keep us going is we had our hygienists call all of our patients and kind of talk them through how to get through some of the oral health issues during the pandemic. We kind of got on the bandwagon with the looking and assisting as where we could with the COVID testing. And we kept it moving. It has really made us more creative, but we did have an initial decrease, but it's back. Things are back now.
So statewide and nationally, roughly 85% of school-based health centers had to close during COVID. And they reported that at least 50% of their volume was reduced, and sometimes it was 85%. It was 15 to 85%, the average being about 50. And again, everybody resorted to telehealth in order to stay connected to these children and their families and to be able to provide the services. And of course, some actually ventured out into the community like Whitefoord to be an adjunct to the COVID screening and testing and all of that, which has just been tremendous, and some of the other places as well. I've been really concerned about school reopening and what's going to happen to these 52 school-based health centers. And we did focus groups and we surveyed, and they basically stated, well, let me just say this, about 60% of our school-based, of the 52 school-based health centers have been operational for less than 3 years. And we know, Whitefoord's been around for 25 years, so, it takes a while to get established. About 80% have only been operational for 4 years. And so I was really concerned that many of them would not be able to resume and not be, because, when school reopens, you're not going to have this full complement of children right there for you, right? It's going to take a while to build it up. There are going to be a lot of parents who are just not going to send their children back to school, no matter what kind of structure they come up with, right? And then, like I said, the focus is going to be on just trying to protect people from COVID. So we, asked what did they need? We asked all of the school-based health centers what was required, what did they think was critical in their ability to reopen and sustain themselves. Many of them said they needed bridge funding to cover them for about 6 months to a year in order to maintain the staff that they had. And by the way, majority of them held on to their staff. They didn't furlough them. They just redeployed them to other parts of their system, which was great because I thought a lot of people would lose their jobs, but they didn't. But to be able to sustain them after school reopens is another issue altogether. And so we've been working really hard to see if we can come up with some funding for some of our school-based health centers to make sure that they can not only resume, but sustain themselves over the course of the next year until whenever we get a vaccine, whenever this actually dies down. And so that's really a challenge, and it's a challenge nationally. And so even on a national level, they are trying to find funding to help centers remain viable. And, they've been sort of, they introduced a request for the third round of stimulus funding to cover school-based health centers. It wasn't picked up by the House, but they're still pursuing that to see if we can get federal funds as well as private funds to do that.
And I will just say that for Whitefoord, we've been around for a long time, so the organization has had the benefit of having some assets that it could draw from to sustain operations. We're a little bit of a larger system as far as school-based health centers go, so we also had multiple locations and activities we could redeploy staff to. We also are a federally qualified community health center, so that from a funding standpoint has helped us because a number of the stimulus bills have dedicated some additional funds through HRSA to SBHCs, and those funds have helped us to be able to take more of a longer term view. But as Dr. Johnson said, nothing is really guaranteed for anybody. In order to maintain operations over time, if the regular amount of care doesn't return to the pre-COVID volume, it is going to have some impact, long-term impact on how we operate, who we serve, and how much additional work we can really do and that kind of thing and growth, of course, too. So, but wouldn't it be amazing? I just think, if every school had a school-based health center, had access to a school-based health center system, I just think some of these discussions about COVID and school reopening would be so different if you had the multidisciplinary group including people with public health and oral health and pediatrics and adult medicine, kind of all having a conversation about how can we make this safe for kids to come back to school, because absolutely 100% kids need to be in school. They would be better off in school. And so if we could find ways to make it safe and have these conversations and have professionals on site, I think, you know, we could do amazing things in the community in terms of improving community health. So
I just wanted to say a little bit about kind of the COVID things that have been happening. We've gotten, to me, additional jobs because of COVID. Now we have to have a person over the PPE. We're wiping everything down every 5 minutes. We have runners to and from the doors. I mean, we've kind of developed new jobs as a result of it. And I think everyone's talking about when we get back to normal, and I think we've all kind of settled in on this is the normal. And so it has created jobs, and I have to applaud our leadership, because it's really created jobs. They may not look like the jobs that they were in the past, but it has created additional jobs.
Very good point. And what advice do y'all give to parents who, if their children no longer have access to a school-based health center during this time, what advice do you give to them in terms of where to suggest to go to health services for their children?
Well, the same advice we give to those who come into other systems of medical care. I work in a primary care clinic in a children's hospital, and our volumes also went down by 50%. And matter of fact, there are a large number of private practices that are struggling to survive because their census went down so low. Everyone is resorting to telemedicine, to tell you the truth. Whether or not the organization is able to sustain it as a school-based health center or as a parent organization like Whitefoord that has, you know, the adult clinic as well as the school-based health centers. Everybody has a unique way of reaching out to engage families to let them know that they're still there and that they still can get their health care addressed. You know, I'm an old-fashioned pediatrician. I'm not as big on technology as some other people are. I love the human touch. I touch people all the time, which has really been a struggle for me during this COVID, especially when I go into the exam room and I have on goggles and mask and, you know, protective equipment and stuff. It's just, and I'm always singing and talking to babies, and they look at me like, who is this monster from another planet singing and talking to me? I know that telemedicine is going to take on a new role. I just hope it takes on the right role. All right. I hope people understand that there are limitations to it, that it needs to be part of a larger system. I have to underscore that. It has to be part of a larger system. It cannot operate alone, which a lot of people are endorsing. And it has to be, and you have to be intentional about your outcomes. All right. So if you're going to provide services through telehealth, it has to be the same quality metrics as you would use with face-to-face. But I do believe that as people have used telemedicine to stay connected during this COVID, it will continue. Everybody's done, I mean, they've invested so much in creating infrastructure for it, they're not going to let it go. And unless CMS completely relents on all of the provisions that they've made for telemedicine, it's going to be profitable to everyone to continue this method of care. But I'm hoping that people understand limitations, understand all those other things I just said, and continue to use it as a way to connect. Another thing that Dr. Patton talked about, which a lot of people are instituting, is, you know, just reaching out to your patients to just find out how they're doing. At Grady, in their primary care clinic, adult primary care clinic, they have brought together about 200 medical students who've gone through every medical chart of every patient that they have in their primary care clinic to reach out to them to just find out how they're doing. And to see exactly what they're in need of, and if it becomes really complicated. And they're also doing depression screenings, which I thought was really interesting. And if they find that they really need a full-fledged telemedicine encounter, they will refer these families on. So everyone is really trying to find ways to stay connected to their families and by being proactive. And I think that's the way to go.
I mean, the other thing I would just say is it's really, really important that kids still be seen, right? Especially for childhood vaccines. I think we're probably all seeing the news about how immunization rates are declining, declined during COVID. And that's because, of course, kids need vaccines 6 months every, or yearly. And we've now been in this sort of new normal for more than 3 months, and that, kids are experiencing birthdays and they're passing those dates and when they would have been due. And I would just say, we have people coming to our clinic, and obviously everybody has to make their own decision, but we try to do that as safely as possible. We have people coming into our clinics, babies coming into our clinics, to be seen. And that's incredibly important. And as a parent, I took my own children in for their vaccines because they were due for them. And so, I would also just really encourage people not to skip that routine care if it's needed, particularly for children, and to make sure that you do find a place to be seen. Many school-based health centers are affiliated with a hospital system in some way, or with a federally qualified community health center that has other locations. And so, there are resources out there, and a lot of them are open. You just have to call first and try to, find the right place or the right time to do that. But yeah, this is definitely why I said earlier, kids need to be in school, and if we can find ways to make that safe, there are just so many benefits to them being in schools, especially ones that have school-based health centers, that, that's going to be really important for long-term community health.
I think the biggest challenge for me is, as a provider, we have to make different types of decisions. I mean, I've been in the game so long that, cutting the prep or taking out a tooth, that doesn't. But if the patient is coming in and they're filling out a form saying everything's okay, temp's okay, and it's relatively okay, and then they're hacking, and we're having to make some decisions, and we will make them because we're going to keep everybody safe. And I think that's important for everybody to know, is that we're gonna make the tough decisions. I think it's scary. It's scary for everybody, but we're going to make tough decisions when we have to.
Okay, I am looking at the clock and know we're about 11 minutes before 1. And so I want to encourage, if anybody has questions, please add them to the Q&A or the chat box, and we'll take them. But while we're waiting for any additional questions, I wanted to ask the whole panel, switch gears slightly, and ask you if you can tell me more about trauma-informed care and the patient-centered medical home model. And what is it about this model that creates health equity? Who wants to start? So
I could go on for 2 hours, okay? Okay, so I'm gonna try to summarize this best I can. So a patient-centered medical home clearly does improve health outcomes and builds health equity, because you're taking care of the child or the adult or whoever in the context of that whole person. You have continuity. You have it's a safe, nurturing place to go. You're doing case management. You are culturally relevant. I mean, it's all those things that sort of falls in line with sort of the social determinants of health that allow you to take care of the whole patient, as opposed to just focus on, I always say, the pathophysiology of disease. You're able to see the whole person. So you're dealing with all the social and economic forces that impact their lives. And so you create a structure where you not only deal with them with their disease entity, but all these other issues that affect their lives. And you set up a system where you not only you don't wait for them to come in, you track them, you monitor them, you make sure that they have everything that they need in order to be healthy. And that clearly builds health equity, because equity is about giving people what they need, not everybody have the same thing, right? Mm-hmm. So it does that in a nutshell. School-based health centers, I have to tell you this, one of the biggest criticisms from pediatricians about school-based health centers is they feel as though they can't be a medical home. And I strongly disagree with them on that. And so I have those conversations with them all the time to explain it just depends on how you create that infrastructure within the school-based health center. I have to admit, historically, no, because it was more of acute care kind of issue. And also they focused initially on teenage pregnancy, and they focused on behavioral health, and then they didn't focus on the integration of behavioral health into primary care and oral health and vision and all of that. But now they do. And actually they're a better medical home. They can be a better medical home than a standalone practice. Because the average practice definitely doesn't have a dentist sitting right next door. Many of them don't have behavioral health services. And many of them really don't have the capacity to address the psychosocial needs of their families. They don't do high-risk screenings. They don't look at, ACEs and trauma-informed issues because it takes too much time. They don't have the resources to do it. But school-based health centers historically do that. We can talk about trauma-informed care forever, but I guess in a nutshell, it is about recognizing, identifying, and being able to address all of the adverse mental health issues that impact the lives of an individual. We focus on the children, but we focus a lot on parents too, because we know that majority of the trauma that children experience come from their home. And so the approach has to be pretty global and universal. Children also are re-traumatized in school. And so you have to really educate the teachers and the caretakers within the school of how they should approach children when they're acting out and when they have aberrant behavior. We now say you shouldn't ask, why are you doing what you're doing, but ask what happened to you. And so trauma-informed really has that perspective of, let's figure out what's going on, what's happened to you, and let's see if we can get to the root of it and create an infrastructure of love, nurturing, support in order to help you deal with it. There's so many models out there. There's so many approaches to it. One that I'm really kind of coming on board with, which I historically didn't think that much of because I'm, like I said, old-fashioned, is this whole issue around mindfulness and being able to self-regulate. I think I've seen the data is tremendous. It's tremendously successful. And so we have all these different approaches in order to deal with trauma, especially in the context of school. I'll let Dr. Patton.
And I would just,
Well, patient-centered care. I mean, I do some practical stuff. Like I come in, maybe it's some type of abuse that maybe has caused the tooth to be cracked or whatever, and so practically we fix it. But it's never just that. It's never just that. I mean, I can, before they even open their mouths, many times I'm saying, "Are you okay?" I mean, I've done that so many times. I can see them coming in the clinic, and I can see it all over them. And the school-based clinic with all of the patient-centered medical home, it's right there. Do you realize how many doctors you'd have to go to get to us? And you just come to one school-based clinic and you can get it all done within a day. And if we didn't do it that day, we could definitely get you in our schedule and get you seen. That would be, I mean, it's just such a no-brainer.
Mm-hmm.
yeah, and I would just add, especially with the kids we see, in our early education program, we have a clinic right there, and we see sometimes behavioral issues that, and sometimes children who've been kicked out of, small children who have been kicked out of other programs, and instead of, as Dr. Johnson said, it's why are you doing what you're doing? It's what happened to you, and I think, we have the great advantage of being able to work with these children and their families to get them some additional services, and we sometimes see dramatic differences in the children's behavior and demeanor. Being hungry will really lead to some bad behavior in young children, and same thing in middle school girls at our clinic at King Middle School. You see girls who are struggling with their weight, and it's not really about the food and the diet at all. I mean, of course it is, but it's really about maybe an underlying behavioral health consideration or a self-esteem issue, lack of family support. And so we're able to address what are sometimes viewed as physical issues by working on the mental health aspect of it. Or, we see the same thing with oral health, poor oral health, and really what you find out is that the family's missing some things that they need to be able to take care of themselves day to day. The child doesn't have a toothbrush or something like that, so we're able to provide that. So those are some of the ways I think that we can use that patient-centered medical home to promote equity and bring people up, meet them where they're at. So, and our school-based health centers let us do that.
Dr. Johnson, there was one question about self-regulation, and I was wondering if I could follow back up with you after this to get information to share with this participant. She wanted to know where she could learn more about self-regulation,
Sure.
especially for 8-year-old boys. I wish I had known that as well.
Yeah, we have a lot of resources I'd be happy to share.
Okay. Great. I'll follow back up with you after that. And I wanted to ask y'all if you can just, I know this is a loaded question, but if you can take just a few seconds to share your thoughts on what you see as the future of school-based health centers in Atlanta and beyond, and what we can do to create more sustainable health centers.
Well, I'll start briefly. I think a school-based health center is a model whose time has come. I think that we're sort of on this trajectory where everyone understands the value of it, and they really want to be able to have that resource in their school, because they realize, as with the last Elementary and Secondary Education Act, they're called upon to create wraparound services for students, because they realize that they need that in order to educate children. And so I can't tell you the number of meetings I've had with school districts throughout not only the Atlanta the Atlanta metro area, but all throughout the state. I had a superintendent from Meriwether County call me up, and he was just desperate. He said, "You got to get down here. I'll make sure you're safe. I'll do, social distancing. I'll buy us lunch." I mean, it was really kind of, it was sweet, but it was kind of like, kind of concerning for me that he was so desperate to come and help them create this. So I think it's, especially in the state of Georgia, everyone understands, recognizes it, from school districts to the state legislature. And so we're very excited about it, and realize that it's going to be a different model, though, going forward because of COVID. But really, it's essentially the same. A different sort of service delivery, but really the impetus behind it and the purpose of it is going to remain the same. And that is so that children can remain healthy, stay in school, and learn, and also serve as a resource to their families as well. So that's the way I see it, and I'm looking for help. So anybody who wants to come alongside and help, please do. Okay, that's all I got to say.
I'm interested in getting more school-based health centers in Atlanta, so that we can connect better and we can serve our communities better. I think we all have the model. I think I agree with Dr. Johnson. The time has come. It's like the perfect choice. And I think that we're ready for it, and we need it.
And I would just add, I agree wholeheartedly. That's part of Whitefoord's vision, is to work with community partners to expand the number of school-based health centers here in Atlanta. And just, we need more trained providers. Mm-hmm. We need more people willing to work in transdisciplinary, multidisciplinary kinds of environments and settings. These are not the same controlled environments you might see in a private practice. So, it's a little different, and we need providers and public health students who are willing to come work in these environments. And then, I'm excited about the potential for cooperation between some large systems in Atlanta. I'm still really hopeful that that's going to happen, because it's going to take the coordination of FQHCs and health systems and school systems to really achieve that vision of an expanded number of school-based health centers. And I think if we come together, we can make that happen. And there is no better time or example than COVID-19, and there's no sort of greater set of issues than what we're seeing around equity right now to really highlight why this is just critical to the future of our kids and of our community. So, yeah.
Thank you. So at this point, y'all did a really good job wrapping things up very quickly. I appreciate that. And I appreciate all the time and your contribution to this webinar. It was very insightful. So I wanted to mention to participants that you're going to be asked to complete a short evaluation form. I'm not sure if it's going to pop up immediately afterwards or if Allie will send that out afterwards, but please take a minute to share your feedback with us. Also, I wanted to share information about the next 2 webinars in this series that is hosted by Whitefoord and the Region 4 Public Health Training Center. The first of these 2 is scheduled for July 7th, and it's focused on health equity in young children. Featured speakers for that one is Ellen Cochran, who's the Senior Director of Early Learning and Child Development at the United Way, and Kimberly Ross, the Early Brain Development and Language Acquisition Senior Manager at the Georgia Department of Public Health. The third webinar in the series is scheduled for July 23rd and focuses on the issue of health equity pertaining to food insecurity. Again, I want to thank Dr. Patton, Dr. Johnson, Dr. O'Connor for joining us today and taking the time to share your thoughts on this important issue. And participants, thank you all for joining us today. And to everybody, have a good day.
All right. Bye-bye.
Bye-bye.
Thank you, Laura.
Thank you.